I was diagnosed with mesothelioma and given 3 months to live 4.5 years ago. So I'm coming up to 5 years, which only 2% live to 5 years. So I'm exhausting all their drugs and treatment options. I'm told by my oncologist there is no more treatment. I can have the same old, same old. I've had to spend lots of money and time knocking on other hospital doors, searching for the country, searching the country for treatment. As my mesothelioma is growing again, I feel so strong in mind but not in body that I can go on in treatment. So I'd like a phase 1 trial. Why not? I'm terminally ill anyway. I sign a contract and a consent form, so why can't I have a phase 1 trial? I should not have to chase treatment. It should all be in a central bank where my doctors can then look in and find it and say, you can have this. At the moment, I'm going up to London and come back and say, I can have this. That shouldn't be on. So I back this innovation bill, and when do I want it? I want it today, because I might not be here tomorrow.
And Mavis, can I ask, so when you went to your doctors and you said to them, you know, look, all bets off, I'll have whatever treatment is around, what did they say to you?
It can't work like that, because it's too much red tape. She can only, my oncologist can only give me what's laid down in the National Health System down in Kent there. I come up to London and talk to Jeremy Steele, and he tells me, yes, you can have this. So I go back to her and say, I can have this. We've done it, and it hasn't worked. Now there's nothing. There's no more. But there are trials out there. There's a phase 1. Is it phase 1, the command trial?
2.
2. Why not use it on me? Why have I got to sit and watch other patients get it and probably may deal? But, you know, why can't I have it? I will sign to say I won't sue. You know, that's how I feel.
Lord Saatchi, this is something that you know, I'm hearing again and again, this idea of the frustration of patients, because actually they're willing to put themselves forward for these trials, and then, you know, because of the bureaucracy, there's this kind of brick wall goes up. So how exactly will the bill help doctors negotiate the bureaucracy that's already there? Because surely one bill can't rewrite all the policies in all the hospitals.
The process of scientific advance has been outsourced to the clinical trial. If this bill became law, the result would be that a doctor in a hospital with a patient, let's say Mavis, can see that the situation is very bad, or Chloe, and would be able to attempt some kind of innovation. The reason this Act of Parliament is so important is that it alters the existing nature of the existing law, which I should just explain in answer to your question. I think if I quote the President of the Family Division of the High Court, Baroness Butler-Sloss, one of the most senior judges in the country, who's given us tremendous advice on the drafting of this bill. In a important test case, the current law is based on case law. It isn't in the statute as it would be if this bill became law. In a case called Sims versus Sims in the High Court, her final judgment said, I think I know it by heart, that if we waited for the Bolam test, which is the current test of the legality of an innovation, she said, if we wait for the Bolam test to be fulfilled to its complete extent, no innovative activity like heart transplant treatment or the discovery of penicillin would ever be attempted. So what the judges are saying is that there needs to be a better balance between defensive medicine, which rightly doesn't want to put the patient's life at risk, and also doesn't want to put the doctor's reputation at risk. A better balance between defensive medicine and innovation. Under the current law, that's impossible to achieve. The balance is much too far towards the status quo. This bill shifts the balance towards innovation in what the judges tell us is a safe way. So I think that's the
just
answer.
to kind of clarify, so the Bolam test, as I understand it, I'm no legal expert.
No.
But that is it's a kind of test, but saying kind of what the average medical practitioner would do and kind of consider to be acceptable. Is that right?
Yes, it's got a very clear. The standard procedure is the term that's used, and standard procedure, as you'd expect in the law, is very well defined. It's not vague. It's defined as that procedure which would have been followed by a responsible body of medical persons skilled in the particular area of medicine in question. I'm quoting exactly. That test, the Bolam test, puts everything on the judgment of the majority of medical opinion. On that basis, you cannot have innovation, because innovation, by definition, is, as I said, deviation from the majority view. That's why Baroness Butler-Sloss said, if you wait for the Bolam test, as just exactly as I defined it, to be fulfilled completely, no innovation would ever take place. That's why this bill strikes a better balance. But you understand, Dr. Pemberton, why it has to be a balance.
Exactly.
You can't just shift from the complete status quo to complete freedom.
Yes.
That's taken 18 months of drafting by some of the most brilliant judges and most brilliant doctors in the country.